Hi everyone, my name is Lisa Mai and I am a graduate student from Benedictine University. Thank you for coming to my presentation about creating a more therapeutic environment on the postpartum unit. So going into this problem, the identified problem that was noted upon my organization is the dissatisfaction patients have voiced regarding the lack of ability to rest and recover after birth due to the numerous interruptions they get by staff and noise. With this, we know that postpartum hospital stay is intended to deliver a space and time for new mothers to rest and recover from childbirth. However, in the standard hospital environment, postpartum patients' rest and recovery are limited due to, again, the ample amount of interruptions to get throughout the day. These interruptions include visits from a variety of hospital staff, students, family, and friends. With this, it is evident that there is a need for a quiet and therapeutic intervention on the postpartum environment to eliminate this problem. This problem is relevant and worthy of addressing via a project merely because studies have shown that increased levels of potential interruptions can lead to acute sleep deprivation. It can increase the risk of postpartum mental health disorders as well as vascular dysfunction. Also, increased levels of potential interruptions can contribute to physiological changes that can reduce the degree of healing and recovery for patients. Subsequently, this can lead to patients staying longer as inpatients and not getting discharged on time. Aside from the negative health effects, the organization's patient satisfaction survey has given evidence that patient experiences were being negatively affected by the environmental interruptions throughout the day. A literature search was completed, and two common themes identified were the importance of quiet time intervention for patients and the positive impact of a therapeutic environment. The first theme of the importance of quiet time intervention for patients, a study that was done by Applebaum, Kalo, and Neville showed favorable responses to quiet time hours for patients. Prior to implementation, 62% of subjects reported their quality of sleep was unacceptable. After they initiated quiet time, the number decreased to 40%. In the study done by Murphy, Bernardo, and Dalton, patients reported that having noise reduced around their rooms made a significant factor in recovery. So again, before their implementation, 43 to 47% of patients said the area around their room was always quiet at night. In the survey period post-implementation, the percentage of patients responded with always quiet at night, which increased to 60%. The second theme of the positive impact of a therapeutic environment, we know that studies have shown that the positive impact of a therapeutic environment have helped staff get caught up with documentation, charting, eating, and just plain me time. This is merely because creating a therapeutic environment means clustering patients' care, limiting interruptions. There's also findings that show that sleep interruptions were lessened because nurses clustered care and developed plans for overnight care. Subsequently, nurses will map out patients' care so that patients know what to expect and reassure them that their needs will be met to establish a more resting environment. The project framework I chose was the conceptual model of family-centered care. This framework assures the health and well-being of children and their families through a respectful family-professional partnership. There are 6 key principles, including families and professionals work together in the best interest of the child and the family. Everyone respects the skills and expertise brought to the relationship. Trust is acknowledged. Communication and information share are open and objective. Participants make decisions together, and there's a willingness to negotiate. These principles will serve as a structure to assist in establishing a family-centered care approach for patients and their families, which therefore can improve patient recovery and improve patient satisfaction. The 3 project outcomes include reducing the number of potential interruptions during the postpartum stay, improving patients' experience, and improving staff satisfaction. A SWOT analysis was created. The internal factors and external factors do play huge factors in any given project. With the internal factors, the positive strengths include this project is cost effective, IRB approval is not required, and service quality for the organization is a benefit. With IRB approval, the FDA has reported that any projects that could potentially lead to more harm than good to patients require IRB approval, which could take subsequently months to years for approval, which can hold back any project. I'm thankful because this project that I'm implementing does not require that. Some weaknesses regarding this project include communication with team members and interdisciplinary teams. External factors, positive opportunities include economic growth for the organization and reputation for the organization. Negative threats include slow growth and improvement, staff adjustment, and change in patient census. The project objective is to foster a more therapeutic environment on the postpartum unit. The setting is Northwestern Medicine's postpartum unit, which is comprised of 110 private beds. Proposed evidence-based change. The pre-intervention phase starts with collecting baseline number of interruptions on the postpartum unit, selecting qualified patients who meet criteria, and completing pre-survey. This will partake in qualitative interview with patients as well. The analysis and design phase engages with analysis of the baseline data and evaluating the overall postpartum environment during trial. During the implementation phase, the project team will collaborate with staff and evaluate the outcomes and environment during their trial as well. Post-intervention, just the same thing as the pre-intervention phase, which is just collecting the baseline number of interruptions, selecting qualified patients as well, completing pre-survey, and partaking in semi-structured interviews with patients regarding their experience. The proposed change in key stakeholders, it's very critical to the organization and community of Northwestern Medicine Hospital, where there's a strong commitment to the delivery of compassionate patient care. The persistent dissatisfaction that patients have stated regarding the lack of ability to rest and recover after birth due to interruption caused by staff and noise on the postpartum unit has been a continuing issue voiced by the postpartum leadership team. The key stakeholders include Kristen Ramsey, who is the chief nurse executive, the postpartum leadership team, who consists of education coordinators, clinical coordinators, and postpartum managers. And lastly, the overall postpartum staff. Budget and cost benefits. This project is bare minimum. So basically the direct costs that are directly related to this project is going to be barely anything. This is merely because this project consists of using cost-effective strategies, and these cost-effective strategies include clustering care before or after quiet time, dimming rooms light, closing patient's door, using library voices, posting door signage, and silencing phone. With the door signage, about approximately a year ago, my organization ordered a mass amount of door signage to help with family bonding. So therefore, I will be using the same door signage regarding quiet time hours on the postpartum unit. So the overall budget would be $0. Outcomes, data collection, and measurement of outcomes. To measure the first outcome, which is reducing the number of potential interruptions during the postpartum stay, count of the number and type of potential interruptions will be observed and recorded by the project team. The number of potential interruptions will be measured between 12 p.m. and 2 p.m. To measure the second outcome, which is improving patients' experience, a post-intervention face-to-face semi-structured interview with postpartum patients using an interview guideline will be employed, as well as results from the HCAHPS survey, patients survey. The last outcome, to improve staff satisfaction, it will be measured by having staff utilize a brief survey that will be conducted via an online survey program to complete. And this will subsequently tell us whether or not there has been a huge change for them regarding regarding the therapeutic program on the postpartum unit. So the future of the proposed evidence-based change, the response of the stakeholders. I presented this topic to Kristen Ramsey, who was the chief nurse executive. She gave me nothing but positive feedbacks regarding this project. She stated that although this organization should be doing hourly roundings on their patients, for the most part, the postpartum patients are stable. So tweaking the hourly roundings is manageable. I got positive feedbacks from the postpartum manager, just merely stating that this has been a project that they have been trying to do in the past. It just hasn't worked, and it could be due to numerous reasons. Our census, the project team weren't committed, and so forth. Same thing with the postpartum staff. They are happy about this change. They know that clustering care is important, not just for patients, but for themselves as well. Most of the time, staffs are having an issue with time management, and they feel like by clustering patients' care, this will help out with time management as well. Two barriers noted are the communication with all team members, an interdisciplinary team, and the overall staff adjustment. We have a lot of senior nurses who just don't like to break their workflow. So having the staff adjust to this therapeutic program could just be a challenge. Moving the project forward, so the next necessary steps to further the proposed project is to introduce the therapeutic program to the overall staff, and then provide education session, facilitate a timeline for the go live intervention, and lastly, just develop a plan for data collection and analysis. Essentially, a key stakeholder who will be willing to coordinate the program is the postpartum leadership team, consisting of the postpartum manager. I believe the most valuable lesson taught throughout this capstone project was learning how to be resilient in the face of adversity and change. As an emerging nurse leader, I have developed a resilient mindset and have viewed failures and mistakes, both work and school, as lessons to learn from and opportunities for growth. With this, viewing a difficulty as a challenge and not as a paralyzing event have and will positively help me step forward in completion of my capstone project. I enjoyed creating an evidence-based project as it challenged me and taught me a lot. With this, there's a quote that I really like: nurses dispense comfort, compassion, and caring without even a prescription.